come up there. Yes, all right, I see you.
We're good?
Very good.
Okay, so I call the meeting to order. What time is it, Paul? I can't see.
7:36.
Okay, first.
Adequate notice of this meeting pursuant to the Open Public Meetings Act was posted on the bulletin board at City Hall on the city's webpage, distributed to the record and filed in the office of the city clerk. The pledge of allegiance. Pledge of allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ms. Boston,
Present.
Dr. Sadler, present. Dr. Solomon, Dr. Sulfur,
Here.
Ms. Davis,
Yes.
Moving on to item number 2, items for approval, which is the board's consent agenda. We'll bundle items 2A through 2D for approval, which includes the minutes of the June 10, 2026 meeting, revenues of $19,397 for June 2026, expenditures of $6,088.26 for June 2026, and employee reports for June 2026. Now, we'll need a motion and a second to approve.
Second.
Ms. Boston,
Yes.
Dr. Sadler,
Yes.
Dr. Solomon,
Yes.
Dr. Sulfur,
Yeah.
Ms. Davis,
Yes.
Moving on to item 2E, retail licenses. Is there anything about these licenses the board should be made aware tonight?
No, everything is in compliance.
Move on to item number 4, board liaison reports. Are there any
we
reports to?
need,
Oh,
approve it.
I'm sorry.
Thank you.
Motion to approve.
Second.
Ms. Boston,
Yes.
Dr. Sadler,
Yes.
Dr. Solomon,
Yes.
Dr. Sulfur,
Yes.
Ms. Davis,
Yes.
Moving on to item number 4, committee reports. And sorry. Committee reports. Are there any reports from any committee meetings this evening?
Personnel will speak during closed session.
Moving on to the old business, item number 5, communicable disease update. Jim.
Thank you. The first part of the report, I talked about the chickenpox outbreak that occurred in Wellington Public School. It was mentioned on the last month's report. And that chickenpox outbreak ended on May 25th. But just to reiterate the repercussions that it had, all those children who were unvaccinated, and there were 10 of them, had to stay home from school for 21 days from the last exposure. And it brought a lot of people up in arms. The parents, of course, were upset, and the children couldn't go to school. And the superintendent wasn't happy because of the school board, and the mayor got involved, and I met with the parents and the superintendent. So it's a lot of, it was a difficult time because the parents wanted the kids to come back to school earlier, or they were in a different part of a building. So as vaccination rates go down, and we see this throughout New Jersey, we're going to see more of this. And this was just chickenpox. Imagine if it was measles or some other disease. And then it could happen again. Like it happened at the end of the school year, but what happens if it happens in September and then again in December? The kids are going to have to stay. The recommendation from the New Jersey Department of Health is unvaccinated children and staff are going to have to stay home from school. So just wanted to point that out. And then everything is FIFA related. And even before FIFA started, I went to a meeting, and they scared me. It was with the state police and the Department of Health, and they say all these bad things that could happen, especially with Fleet Week and 250th. So so this report came out on July 5th, and probably get another one. So this is the FIFA report. And so they're looking at all the diseases, so they're looking at the emergency departments. And they're also looking at the wastewater concentration levels and other things to see if there's anything fishy going on. And so far, so good. Things have been very quiet. We work in 17 towns and the health departments have been very busy with all these extra events and food truck events and we're a lot of overtime being spent by our health departments to have them and Englewood's moving along, but of course they're always busy, but there wasn't anything special or in particular for the FIFA World Cup. And then lastly, one of the most common questions I get as a health department is spraying for mosquitoes. You know that if there's a person that tested positive for mosquito-borne illness in the town, that the Bergen County Mosquito Control is going to come and spray for adult mosquitoes. Well, on let's see, June 10th, they sprayed in the towns of Leonia, Teaneck, and Richfield Park, and in the Overpeck Park area. I thought that was odd because why are you spraying so early in the season? And Matt Bickerton, the entomologist at Bergen County Mosquito Control, told me that, well, the reason we're spraying now to knock down the adult mosquitoes is because we're worried that people from FIFA, from countries that have dengue or yellow fever or malaria, they're going to come here. And then if a mosquito bites them and then bites me, then it's going to be a local transmission. So it's kind of like a preemptive strike on the adult mosquito population. So I thought that was interesting.
And why did they pick those towns?
I know, why did they pick those towns? I guess they had, it was some request. I don't think that they picked them. They
I-
said
I read something about the wetlands in the area.
May
Meadowlands,
maybe that's because maybe they were doing mosquito surveillance and they noticed a rise in the adult mosquito population in those areas and they picked that. And so they went ahead and sprayed in those areas. And the towns have no say so. Like if Leonia wanted to say, no, don't come here, the mayor or the council can't say anything. They're gonna come and they're gonna spray the insecticide, duet in their areas.
Yeah, the last game is the 19th. That's the final game of the World Cup here at MetLife, yeah.
Okay.
So we've had a lot of emergency preparedness.
Oh, so right, so,
Yeah.
right, yeah, because they're all,
A lot of people.
yes.
Yeah.
Okay, so you could
No, it's just about,
empathize.
100% being prepared, what could happen, you have an overload of people, there's definitely a lot of alcohol.
Oh,
You know,
yes.
being prepared depending on who's playing where, plus, well, a lot of international things that are coming in that wouldn't necessarily have been in the country, so. You have to be prepared.
What day? July 15th?
19th, and Sunday the 19th is the last game, at least that's what the billboard's saying, but
I guess the saying is. Prepare for the worst, hope for the best. So good, okay, thank you, that's my disease surveillance.
Did you want to address the Lakeland manufacturing license fee issue?
Are we ready to do that? No, is that next on the
Yeah,
agenda?
it's the next one on the agenda.
Yeah, I just wanted to say, I'll open it up and just say that I did have a conversation with a staff member. Who had reached out to me and reached out to Jim separate occasions. Just to talk about her concerns regarding the burden on the staff that this that this would present. Whether or not what we do for Lego or me, if we do something for them that's different, would it affect other licensees in the city? And we would have to do something for them as well. Would it, make changes on a broader scale? Also talked about whether or not it was really a good idea to do the tiered system rather than just maybe have a couple of times to license. Not talking about the temporary, the food truck issues or the event issues, but just not breaking it up so much. And also suggested that if we do anything, we do it in 27. That we don't make any changes now, that we look at it and change what we have to in 27. And that we follow the licensing periods that are identified right now in the ordinances. Which I think is March to March or March to 6 months and then 6 months out. But she was concerned. I told her, of course, I couldn't make any decisions on my own, I would bring it to the board. It's a democracy. We have been talking about this on and on. And when I think back, I think this really only started because he wanted to cut his fee in half. And here we are 3 months later talking about it and really, and going into it. And we do at some point have to put this thing to bed. But she just wanted to make us aware that, as she put it, we're the eyes and ears of the board, the staff. And that we're the boots on the ground and we know sort of what's really happening. So I don't know if you want to add anything from your
Or
conversation.
just if we can have, just to clarify, for clarification purposes, the current fee structure that they have right now is that the owner has an operating fee of $1,500. And then the vendors at the facility are still paying a fee, which they could be, there's 3 tiers currently exist in our ordinance, which are the 6 month, the 3 month, and the 1 month. Is that correct?
Oh,
Oh, you have it
handouts
right
right
there.
there. Oh, right
Thank you.
there.
That's
the
exactly,
original.
thank you.
No, the one you're holding, yeah. And he's back in
That one.
front. Sorry, I didn't have time to put the.
No, it's not. I think it's,
Yeah, so it's right here.
Yeah.
So up
So
to 10 days is $30.
Is there an extra, Mr. Wilson? Does-
Oh, yeah. there's one.
up here. Oh, it's like a 1, 2, 3?
Yes,
Okay.
that's what.
No, there's
Oh.
another one.
That's the one. I'm sorry. I
Yeah, the
thought they,
shrimp cooking
I'm sorry.
facility,
This is the one right here. Yeah.
yeah, so
Yeah.
So there was it's $250 per kitchen unit. They had 6 units, which is why there was a $1,500 fee.
Thank
And
you.
then each vendor, there were 3 options. If you were only using it up to 10 days, it was $30. Up to 3 months, it was $60, and up to 6 months, it was $150. And what we've established was that, number one, that people were doing small renewals. So like they would do 3 months and then 3 months, which was $120, when anticipating should have been the 6 month fee. And so the numbers are off. And so there's always been a tiered system in our ordinance. What we had discussed as a budget committee was that for the amount of hours that we were putting in, these were very low. So, we had discussed coming down on the shared cooking facility fee. We don't have to do that, in general, like we could keep it as the $250 per kitchen, which is what the restaurants are charged right now. The proposal that we had suggested is maybe coming down on that, but that's definitely doesn't have to be done. But for sure that these shared cooking facility charges, as far as the work hours were not meeting the amount of, they were not covering the amount of man hours that we were putting in, which is why we proposed raising those fees with different numbers. So we suggested, instead of 10 days, 3 days, 3 months, 6 months, doing a 3 months, 6 months, a year, because it sounded like a lot of people were long-term vendors. There were 71 as of May. There's probably more vendors there now. And for each vendor needed a separate site visit. And so that's at least 2 visits. And then if you fail, that's more. So there's automatically more visits. And so, I'm not sure where there was a misunderstanding. We weren't instating tiers. We were enhancing our current fee structure of our tiers. So there was never going to be, we always had tier structure, which is what we're doing now. So that really didn't change much other than the time period. The only thing that was also discussed after we had it is, do we do it based on risk instead of just on length of time? But because maybe there are some vendors that aren't really doing major cooking and they're, for whatever it is, they're just doing, I don't think anyone's doing packaged stuff, but if they're preparing foods there, that are not being cooked and they're cold to cold, we suggested that maybe we could have a lower fee for that. But if that becomes too time consuming to differentiate who's doing what, we can certainly just do it based on time. I don't know if you had,
Good.
if there was any other thoughts.
My thoughts always based on time. And how.
That's not, yeah, because that seems to me.
It's a
How
number,
to get
right?
it done. I mean, whether regardless of the type of food it is, or coal, or the time it takes to cook. They're
They'll
coming
need the two
out
visits, yeah.
to make those visits. I think we need to break it down to another two.
Right, and certainly don't
I know.
dismiss.
If it even-
Mhm.
That is a good idea.
I mean, that's my,
What?
Based on risk.
Well,
But-
that,
Yeah,
this was, yeah, so, oh, you, maybe you were there, so there were the 3 types of risk.
yeah,
For the visits, and so I don't think anyone in there is doing the half hour. These are like people who already take package to pack, like they're selling packaged foods that already come, like you're a vendor. You know, and you buy something packaged and you do it packaged, so there's really no prep involved kind of thing, or it's like a slushy, so it's popcorn slushy. But the type 2 was a shorter inspection, which was things that are cold, ready to eat that they identified. And that was a shorter time inspection versus the 3, which you're actually handling, you know, raw to cooked, which requires the most time. So that was the only other thought, that if you wanted to break it down based on risk, because they still have to go for time, it may not be as long. But so there's 2 different factors. And clearly, you know, a type 1 or a type 2 risk is much different exam than a type 3 risk.
And would we consider 6 months and a year? Just putting it out there,
Instead of doing less.
the 3.
I guess the question is, how many vendors, I don't know what his vendors look like, right? So if these are, I can understand, like, if it's like, kind of like mom and pop, someone who's doing, you know, their own small business, they need a like a restaurant type kitchen to do whatever they're doing in. I definitely don't want to discourage small vendors. You know, that's where people make money. It's nice, and we don't want to push them out. So I don't know what kind of vendor pool are going in there. Are there people that are really just doing something and they do everything in 10 days or
Right.
3 months, and then they don't need it for the rest of the year? I guess it's possible.
But we
that-
said most for long term, right? Last time, I read it in the.
think a lot
minutes,
of
I
them
think.
Were
Most
long
of
term.
them
keeping those people
Right,
on.
and then, and I mean,
Month after month, if they
Right.
were doing the 6 months, and they would take another 6
Right.
months, so. I think,
But they really know they're gonna be there a year, but and I'm not speaking of anybody, you know, in particular, but if you do 3 months and 3
Right.
months, you still pay less than you would for 6.
in our
And you
current
pay
fee
6 and
structure,
12,
which is
so-
why the fee structure that we
It's
had
not-
proposed was the year was 250, because that's the max of like a restaurant. 6 months is 150, so that way if you try to renew your 6 months, you're already over your 250.
Right,
And then your 3 months was 75, which is the same thing. If you upped it, then you would equal your 6-month fee. So it would a way of discouraging that sort of lower fee structure.
I like that idea, the fee structure, so that won't recur. Because I think
Doesn't
that's probably
encourage
what's
them,
going
yeah,
back
to
to
do
over and over again.
It would also, you know, potentially if people were doing that, like the 3-month renewals, that were more licensing, more paperwork over and over, versus this is, you know, you're not gonna get out of it, so you may as well just pay your 6 months and it's one license.
Elisa has a question.
Yeah,
What's the
like,
question?
what happens if, really, I'm just thinking about what happens if other places want, you know, depending on risk instead of size or,
Yeah.
you know, facility, that kind of thing.
Yeah.
I mean, I don't mind the proposal because, you know, that it helps with the time and that's put in and stuff like that.
Yeah.
I think that's just something to think about.
Yeah, so right now it's not based on risk, but our
Yeah.
proposal was not
Yeah.
based on risk.
Yeah.
We talked about it as
Yeah.
a possibility.
That's what I mean. I'm like, I like the.
Right.
I like that idea too,
Proposal,
but
but
yeah, I think that it's
Something
not
to think about.
practical.
Right, so the original proposal we had was just revising this ordinance, for the structure, which is, we can decide whether or not we're gonna continue the overarching shared cooking facility charge. And then each shared cooking unit, that I think that would be vendor, not really each unit. And changing it from 10 days, 3 months, 6 months, to 3 months, 6 months, a year with the higher fees.
So we had a question about that, Jim, right, about cooking facilities versus kitchen unit, didn't we need to
So,
clarify that?
So on this, it says.
That's the longer,
That's
the
a long.
3-page one.
Yes.
What defines a facility versus a unit?
So he has, Nick Crassos, the owner, Le Gourmet, has 5 kitchens in there.
6.
Six,
Six,
correct,
6
very good, thank you, 6. So Nick pays a fee of $1,500 per year, and the reason is because each one of those kitchens is $250.
Correct.
That's what that means, so that's why that.
Okay.
But then it just said facilities versus unit, but the shared kitchen unit is, it's not really the unit that's being inspected, it's the
Right.
vendor, so that we should probably have some wording. Change just to
Yeah, wording
identify
has to-
what we're.
Do you
yeah.
understand, Brad, what we're talking about? So he has 6 individual kitchens in there, and the health department charges $250 for each one, and that adds up to $1,500 for the year. And then you see the confusion, then each vendor is charged based on how long they rent it.
Right, because it's one thing if it's a single restaurant kitchen that does the same thing every single day. But here you have multiple people coming in
For multiple amounts
from
of time.
and multiple times, but also different items that they're doing, and it's not consistent.
Different
So
on
each
each.
one is responsible for food handling, certifications.
But every one is an individual something,
Right.
and that's.
So that's the
the
bigger problem.
With an individual staff requirement. To go in. So how do we put this debate, folks? And I don't mean it like it
Yeah.
sounded, I just mean, we
Yeah.
don't,
No.
Do
we can talk about it
this-
from
do
the
we
next
keep
month.
the shared cooking facilities as is, or do we lower it? That's the first question, and the second question is then. It sounds like we're all in agreement that we have a tiered, established, shared cooking unit / vendor charge now, but it's insufficient to cover the amount of work that needs to be changed. So I guess, question number 1 is, are we going to continue the shared cooking facility of $250 per kitchen, which for this shared facility would be $1,500 as an overarching fee in addition to these vendor fees? Or, and then if we're keeping that higher charge, do we then go down and lower the individual vendor charges a little bit? Because the reason we had proposed to raising it is because we were gonna eliminate that big overarching fee, the $1,500 fee, and bring it down a little bit, but.
I was just looking at the portion that says up to 3,000 square feet at 250, so that's where the 250 comes in.
For the
Unless
overall,
they
because
burn in there.
So that was 6 kitchens, I think.
6
and everything.
kitchens,
Right.
250 each,
So-
that's how it came in.
Maybe just adding some words about to bring his fee down, maybe the first 4 at 250 each, and anything above that.
That might
would
be,
be one way
a
to,
reasonable.
way
Mhm.
to bring his fee down, since we know that he has 6. And I don't know the establishment, I don't know if there's room for 10.
No, I think
So-
6 is how that facility, he doesn't have room to add more kitchens unless he gets
And
more
at this
space.
point, we should leave.
So I think if we charge them maybe for the 4
Mhm.
and the additional. Anything above those 4 up to, say, 7 would be.
Yeah,
Yeah.
I mean, I agree, because I think that that those inspections are happening at the same time,
Right,
right? So it's not like those inspections aren't, and so I would be fine with that, bringing down that larger fee.
then
Like to that.
having the tiers for the
Yeah.
individuals that are vendors, or. I don't know what term we want to call them as they
Mhm.
come in, if they're in the kitchen for a period of
Right,
1 month, 6
I
months.
mean, I personally would do 3 months as the minimum.
3 months.
3 months, 6 months, 1 year would be my opinion. I don't think we should do 10 days, like, that is already more work, like, each 10 days, each 3,
3 months.
I think
starting.
3 months,
Yeah.
6 months, 12 months is it's the same tier structure, it's just bigger. And then the question is, you know. If 6 months was 150, that means technically a year would have been 300. I'm even proposing less. I said 250, because that would be like our max, similar to what a restaurant would be. 250, then 150 is 75. So as the year, 6 months, 3 months, that's what we had proposed.
So each of those people would have that tier system.
And he'd have his own. Mhm.
Be based on the fact that he has 6 kitchens, so he has to be charged based on at least 4. And the
I think
others,
that's reasonable.
So let me just go back to be devil's advocate, just
Yeah.
1 minute with what you said. When you say start at 3 months, that means if you're there 10 months, you're 10 months. If you're there 10 days, you're paying 3 months.
Correct.
So just want to be clear.
Yes. I don't know, I think originally when we did this, it was a very different situation. It was
Right.
years ago,
It was
the
what?
proposal was different, there were very few vendors. It was like, oh, people are just gonna be short term, they're not really gonna come, but we see that over time, that's not what's going on. So,
Yeah, and from my personal experience, there's a lot of local chefs that I know who've come and done services who are definitely using these smaller kitchens. They don't have their own restaurant. So
Right.
the numbers of catering services has definitely increased. Who are
so they're doing their
space.
prep there, and then they're going to the facility where they're bringing it out, right? Cause
Mhm.
probably that's how it is, like setting up or drop off or whatever it is.
Yeah, there's a demand for his service.
Mhm.
so he's making money, and I think we need to make sure that our staff is adequately.
Right. I mean, our staff is going in there, we're paying, those are man hours that we have to cover.
As
So,
long as we're covering the man hours, time, if they spend adequately, I think is first and responsibility to the staff. And then, want to maintain business in the community and be good in that service also, but we just can't give away the time.
and the other thing that would be interesting to find out, is of the vendors, like, I think there's 2 questions from the kitchen, like the shared kitchen facilities, have there been any failures? And then of the vendors, have there been any big failures of
Inspection
failures? It's a way of us understanding how much extra on top we're doing. And which type of vendors are failing, inspection, is it someone that,
Keep it out.
yeah, is it a repeat, it's just, these are questions that I don't know the answer to based on the reports that we looked at.
Okay, so that should be pretty easy to get, right?
Yeah.
Then-
We'll check and see.
And how many people do we have doing the licensing? The licensing, how many? And then
There's
the
the
inspections.
license clerk and the alternate, usually.
So they
take
get
care.
us,
It's usually the license clerk and the deputy license clerk
Okay.
typically taking care of it, but we also have, all of the vital statistics.
But they're already doing 70 licenses, if there are 70 vendors, they're already doing 70 licenses just for this. And it's probably more, because that was the main number.
Yeah.
And they said in the proposal, he anticipated by like June, it was in the 80s, if we run out of that thing that was set up. So we're still fielding 80 vendor inspections,
Right,
and we're still giving those licenses.
and he still wanted a reduction in his money.
Yeah.
I mean, something is a reason.
more work,
Yeah,
But
more work for less money, it doesn't,
Yeah, he wanted it to be
that's
less.
how this started. and
Well,
we're
from what I
gonna address
understood, he
that.
wanted the vendors to pay less.
Right.
But the only way for the vendors to pay less is for us to charge him more.
Yeah.
Because we're doing all the work, the work is the work is the work.
We
The work is the work.
Right, so we need to be compensated. Is it gonna come from the vendor, or was he going to pay? And present it. And with an increase. Going from 250 each to. I don't know.
And if we get the money, we as the city, the staff still doesn't see that, and I don't know the answer to that, I'm just.
They're getting paid per hour, they're still getting paid
I
for
mean,
their
they-
hours, it's just a matter of. If we're paying overtime, which sometimes the likelihood is we're not gonna be able to fit all the hours in. And that means we are paying overtime, which means we need to still cover those salaries,
Or do we need more consultants?
Right.
come in?
more staff,
Where I'm going.
Yeah.
which would still mean more money.
More money.
If we're expecting him to grow and we're
We're
expecting.
accommodating. It's growth. Which we have.
With the people that we have. So. See, we have the whole picture here because she's got the money and I'm just trying to keep, right, I'm just trying to keep everything balanced, yeah, so. Okay. So what do we, Jim, I didn't let you speak, so how do you propose that we do this? Do we just wanna give one final proposal and come back?
I
to the,
like to propose.
What are we doing? The September meeting.
So, I mean, if it sounds like unless there's any, we can do a revised ordinance for the next meeting with the proposals that we're talking about. So that would mean changing the wording of this to shared cooking facilities, 200 per kitchen, up to 4 kitchens. And then $50 per kitchen. Is that what you were saying? Up to
Up to
It's a big
4
jump.
kitchens
Mhm.
would be.
the 250 each,
Right.
up to 4, and beyond that, what do you do?
And
Would you have
I think
smaller?
50 is low.
Huh?
I think.
I know.
50 is low.
Yes, but we're trying to reduce the
Yes.
fee,
right.
you know, but we have a max, like that means that it would be up to, you know, whatever, 6, 7, whatever it is, 8 kitchen, you know, we could say up to 8, $50 additional up to 8. I'm
She's
just
got 6 now, right?
right, and that would be, it just reduces that fee from 1,500 for him
Right.
to 1,200 or whatever, you know, but it's still
It would be a
drop.
sum.
It's still
Reduction.
more money.
And then revising this shared kitchen unit. I would say we should adjust the wording there, so it's very clear that it's the per vendor, and then the ordinance would change.
Suggest, I think you need the definitional section.
Yeah, I don't know where it is on that, but then it would be the tiers 250, 150, 75. So if we can have a revised ordinance of those changes for the next meeting, we could do a first read. If we disagree, we revise it and we come back.
Definitions
Yeah,
of.
Including the definitions of what each one, what who
Shared
pays for
kitchen
each one,
staff.
what it is.
You
Yeah,
said 250, 150, and 75.
yeah, for 1 year, 6 months, and 3 months.
You're
And
right,
that way
you
we
need a
do a
definition.
read. That way we can do a read, and then it's open for comment if anyone wants to come and re-comment, you know, at least we have the ordinance in front of us that we'll do a first read.
And they will come.
Okay, which is fine,
He's
that's why we do.
welcome.
a
He's
read.
welcome.
And this would be in effect for next year, or
I guess if.
I'm not gonna say next year because we have to have the first read.
this is a.
I mean, by the time we get a first read and second,
Yes.
it might be
Yeah.
effective right April 1st. so-
Yeah.
It'll be next year either way.
Yeah.
No.
If you guys could just confirm that the licensing fee timeline, what's the actual start date?
March
If it-
March to March.
It's March.
March, yeah.
March to the end of.
Yeah.
Aim for March.
Yeah, I mean,
Yeah.
we'll say. Cause it would really be for new licenses.
Yeah, for the
It would be for the new, anyone who's new, anyone who's already paid their licensing fee is not, we're not gonna upcharge them, they have their license already, so technically it would be for. You know,
Becomes effective
right,
March 1st.
Okay.
Moving on to new business item number 7, the 2025 annual report.
All right. So you've received the draft 2025 annual report. Please review and send any suggested changes. The final draft will be approved at the September meeting. And just a couple of the highlights is, included are the aqua, aerobics, the water wellness program. So as you all know, it's the low impact fitness class that's at the McKay Park Pool. And, in 2025, we had 102 participants, and approximately 80% were Englewood residents. We also did the Take Control of Your Health Chronic Disease Self-Management Program. It was a 6-week evidence-based workshop done at the Southeast Senior Center, Cecil. Yeah. And it was a way to help older adults better their health and help them with their chronic diseases and stuff like that.
That was Priscilla and Claudette who taught the class.
Priscilla and Julie, our health educator. And 11 participants completed the program. And then we also did a couple of programs to promote employee wellness. We did the Wellness Wednesdays, and that was for department staff, where we had trainers from gym guys come in and they did yoga or stretching during lunch. And we also had,
Nice pictures of your staff.
yeah. And then we had the annual nutrition challenge with Life Hive Nutrition. So that was with all city staff were welcome, and Englewood Post School staff were also welcome. So yeah, that was
Well,
those some thoughts.
And that was great. Everything, the layout, 2 formats, I guess I'm looking at, you were
Yeah,
proposing.
we're working on format and adding some more pictures and things like that. So
Okay,
Great.
I thought it was great. And it's nice that community got involved with the donating the water, I said.
yes,
I thought that was.
Rico Water has been donating water for all of our programming, which has been great. So
You need the water.
yeah.
Yeah, it's pretty cool.
Moving on to item number 8, public health events and outreach. It's probably already covered.
Yeah.
Pretty much, but I have the flyers
there.
Flyers here. We have the
Okay.
water wellness
Oh.
going on.
So, walk and talk with, healthcare
Healthcare providers,
started tonight.
yep, starts tonight at Flat Rock Brook. There'll be 6 dates. So providers from Englewood Health and Newbridge Medical Center. They're all gonna be there, talking about specific health concerns and answering questions, so please sign up or just drop in at Flat Rock. The dates and times are going to be on the marquee, on our website, social media, because they alternate. They'll be on Wednesdays and Saturdays throughout July and, August. Great.
Moving on to item number 9, other business. Is there any other business to discuss tonight?
Yes. We applied for another grant. It's the local public health infrastructure grant. And the anticipated award is $119,372, basically. So we're looking forward to, right now we're looking into possibly digitizing our vital records. In case of, natural disaster, fire, anything like that. And also possibly looking into electronic medical records for the clinics to,
Can we digitize records earlier?
no, not that. We have like, the online system, but
But vital statistics.
yeah, vital statistics, but, they would like scan all the old records that are, there so that
Oh, okay.
they're in the system.
I thought we tried to do an EMR already.
We did.
It
We
wasn't-
tried. It wasn't really user friendly, the
Okay.
one that we tried.
Okay.
So we looked into another one, so Athena Health.
Yeah.
And we know that like a lot of places use that one.
Okay.
So,
If you, I mean,
Yeah.
some of us are using that like EMRs, so I would definitely find out from physicians what they find is user friendly.
Yeah.
And maybe see if there's a lot of incorporation of AI now to help with medical records, so.
How are you gonna use
They
it?
don't use
Somebody's
AI.
gotta go,
No, they
somebody's
don't
gotta
use-
go in there and make a
No,
copy.
no, it's not, it's just like using it for documentation purposes where, the AI is taking what you're talking about and putting it as a medical note.
That's interesting.
So a lot of doctors are using it now. I don't use it. I don't know if people are using it. Our hospitals have to use it. So, but, moving us into that
Yeah.
time might be, it might be something to consider when you're looking at vendors and also what their storage capabilities are, how much tech that they provide for help if you have questions or things that are new development and upgrades, because you want to make sure that those are included in your package.
So would you suggest that we get vendors from local positions that we're using?
We'd find out what some physicians are using, we have a physician coming in, if they're using a medical record in their practice, or, what the hospitals are using. We can tell you what we're using. I mean, New York Presbyterian uses like the Epic system, which
Yeah.
a lot
Big
of
places
big
use
places use.
and we're not,
Everybody uses
we
that.
can't use Epic.
It's because of the
Why not?
cost, right?
We are not large enough to use
Yeah.
Epic, so
You need
yeah,
bigger.
you need more, yeah.
So there are other ones and some of them interface, so you might want to just find out about some of that.
So the one that we tried to use that we bought that didn't work, did we pay for that?
It was through, past grant. Yeah.
Yeah.
So we just, and I don't miss judgments, we just abandoned it.
Yeah.
They're definitely small, private practice physicians who are using EMR, so.
It's not connected to the gospel, I think is.
And then the last note is that our contract with Care Plus New Jersey has ended for now. So just wanted to let everyone know that.
Okay, so at least we have a contact for future to, whether or not we go back to it.
We didn't have a lot of people, we didn't have a lot of, I think we have a lot of need, we just didn't have a lot of referrals, right?
Moving on to public comment, the board will require a motion to open the floor to public comment, a second and a vote. Speakers will have 5 minutes and must state their name and address.
So moved.
Second,
Ms. Bostic,
Yes.
Dr. Sadler? Yes. Dr. Solomon,
Yes.
Dr. Sofer,
Yes.
Ms. Davis?
yes.
Notice on me.
Oh, yeah, sorry.
Go first.
So, sure, I'm here one. A couple of quickies, just,
Identify yourself.
oh, I'm sorry, thank you, Stephen Weinberg, Broad Avenue, Englewood. Is that sufficient? First question, maybe for James, the spraying that they do in mosquito control, does that have any adverse effect on the pollinators? Like, is it very, very targeted to mosquitoes? Or does it have?
It is not, it kills every insect that it touches, so when they go down the street, they're killing moths. Bumblebees and.
Beneficial insects as well,
Yes,
and we have no say over this at all. Okay, who's running that program?
Bergen County Mosquito Control.
Thank you. Item two, thank you very much. Item two, just a note. Once again, there was a blood drive. And thank you for everybody who set that up. I'm always happy to give and give generously. 1 pint. But once again, the company that's running this program is Vitalent. And once again, they are being a nuisance. Because immediately after I've given blood, they're already out for my blood. Oh, you have a blood type we need. Can you give more? Like, as you guys all know, I mean, at least 56 days between donations, all right? Leave me alone for 45 days, okay? But they don't get that. So we're talking text messages, emails, voicemails. I mean, come on, guys, so let's do something about that if we're gonna continue using that company. So I think they're all vampires, no matter what company we use, but maybe we can set some ground rules for these people. And then one last, just a quick note. I follow some of this, ANJAC, which stands for the Association of New Jersey Environmental Commissioners or Commissions, ran a program called Tap Water Tuesdays. It was a Zoom session, which was a very it's over, I'm sorry, late notice to you guys, but it was a very informative set of Zoom seminars on water quality in New Jersey, big discussion on PFAS, which is the forever chemicals. And then lastly, lead in our tap water. And apparently there's some legislation out there currently that we should be aware of that speaks to the obligation of the water companies like Veolia and American Water. We have Veolia here mostly, to remove and replace where identified the input pipes to the residents that may be lead or even galvanized metal pipes. That is a long-term project that's been in play already and is going for like a total of 10 years. But we should get the word out so people can get the because a lot of people in Englewood have older homes. So if you have a home that was built in the fifties, I can almost guarantee you that it's not gonna be using a plastic pipe. Right, it just wasn't available back then. And so unless that was changed, they could be eligible for a free replacement. Right up to their first valve. Okay, what happens in the house is their business. But the company would be responsible for that. So I just want to make you guys aware of it because it is a health concern. And that's pretty much it. Thank you very much. Oh, one last, just, I'm just gonna express that I liked, the commentary on the gourmet factory and licensing, ideas. But yeah, it's a silly question, but is it in effect double dipping to hit up both the owner of the property and all of the vendors that come in and use the kitchens? It seems to me that he does have a valid argument because you're gonna bring one inspector in once for his 6 kitchens on a yearly basis, and then you're gonna bring in inspectors each time there's a changeover of a new vendor who's using the kitchen, right? So you're certainly hitting up all of those people, and then you're hitting up the vendors. So it just seems to me that it might be possible to, as you pointed out, give him a little discount once, because it's a one-time visit where you cover with one visit all of his kitchens. Just a thought. But I think you guys are heading in the right general direction. So that's my comment. Thank you very, very much for your time, and guys have a great summer.
Quickly, we did address that when you first opened, and we felt that when you license the facility, then it's holding the facility responsible for maintaining the temperatures of their walk-in refrigerators. So we needed a responsible entity in itself, and so that's why we have the license and the license fee for the facility itself, and then all the other ones underneath it. So it's more of like I guess maybe a term might be an umbrella. So, and that's why we structured it that way. And I think that we need to keep that.
Thank you. Is there any other participant in tonight's public session? And if there is no further public discussion, we're in a motion, a second to close.
Motion.
Second.
Ms. Bostic,
Yes.
Dr. Sadler,
Yes.
Dr. Solomon,
Yes.
Dr. Sofer,
Yes.
Ms. Davis.
Yes.
The Open Public Meetings Act of the State of New Jersey permits the exclusion of the public from discussions on employment matters. Going into closed session requires a motion and a second.
So,
Second.
Ms. Bostic,
yes.
Dr. Sadler,
Yes.
Dr. Solomon,
Yes.
Dr. Sofer,
Yes.
Ms. Davis.
Yes.
Thank you very much, everybody. Have a wonderful rest of summer. We'll see you in September. Okay, take care.
See you.
Bye-bye.
And to-
Hmm?